Thank you so much, everyone, for joining me today on Talk to Me Africa. I am really excited because the platform is expanding. I have my guests from Kenya and from India. I am so honored. I would like to welcome Dr. Sharma, who is a neurosurgeon, today to Talk to Me Africa. Welcome, Dr. Sharma.
My pleasure, Mabelle. Yeah.
Thank you. Thank you so much. I have plans to visit India, and I think I want to go to Bangalore because I have co-workers who are from Bangalore. Maybe I'll meet you someday in person.
Look forward to that.
Thank you. And we have Sylvia Mochabo, all the way from Kenya. Sylvia, you're presenting AndySpeaks for special needs persons. Welcome to Talk to Me Africa.
Thank you, and thanks for having us. It is our pleasure to be here with you.
Thank you so much. And Winnie, DCP, Kenya. What does that mean? Welcome to Talk to Me Africa.
Yes, Mabelle. I'm here. I'm Winfred Wagui Magima. DCP Kenya stands for Diaspora Community Projects. So we have projects that we are doing together with other diasporians, and we are happy today to be here with you, Mabelle. God bless you. To be the doctor, Sylvia.
Hi.
I'm so happy. I'm so happy. This is God, and I'm so grateful. I'm humbled.
Thank you. It's such a beautiful network that we have. I couldn't believe that we could have this connection between I'm based in California, you're in Kenya, and Dr. Sharma in India. But hey, when it's something that have to do with the world health, then we will talk about it. So I would like to start with Dr. Sharma today on the show. Dr. Sharma, welcome. What is autism? What is that?
So autism is basically what we call a neurodevelopmental disorder. That means it is a disorder of the brain when the brain is developing. Now, basically in autism, there is a combination of three sets of symptoms. One, these children cannot communicate. They don't have speech, and so they aren't able to communicate. Second, they have certain repetitive behaviors. They repeat the same actions again, and they can get hyperactive, they can get aggressive, they can hurt others, and they can hurt themselves. And the third thing is they lack social interactivity. They cannot, relate to children of their age, other people, and so they cannot have a normal education, which means these children become dependent. You understand, if you cannot speak, if you've not had an education, if you have certain repetitive behaviors, obviously you are now dependent. Now, the thing about autism is the phenomenal increase, in the last 20 years or so. And about 20 years ago, 1 in about 200 children had autism, and now it's come to about 1 in 50. And the incidence is just going on and on increasing. Now, interestingly, what we are finding is that people, because we have people coming to us from all over the world, we are finding that people of African origin, when they leave their countries and go to America or Europe, there is a much, much, much higher incidence of autism in them as compared to those who stay back. All right. And so we don't know what the reasons are, but the fact is that those, when we relocate, whether it's the diet, the climate, the toxins, the environment, there's so many possible reasons, lifestyle changes, but there is a tremendous increase in those who are living overseas, a very, very large number. So, today there are 70 million people with autism on the planet. That is 1% of the world's population. People don't realize that 1% of the population on this planet today has autism, and what is worse is this number is increasing. It's increasing exponentially. It's increasing very fast, and we now have a large number of children who are so completely dependent on special needs care, on rehabilitation, on certain medications and things like that. So that is what it is. It's a neurodevelopmental disorder. It happens to occur 3 times more in boys as compared to girls. And the diagnosis is normally made around 2 or 3 years. It's just when the child is to get socially interactive, that parents notice that the child isn't talking as much, there are behavioral issues and all of that. So that's when the diagnosis is made. So I actually call autism an epidemic, but it is unrecognized. Governments, the medical community, the medical profession, scientists don't realize the very, very massive increase in the incidence of autism. When I was a medical student about 30 years ago, though, autism hardly existed. It wasn't even hardly even mentioned in the medical books. It was such a small incidence. So there is something wrong in the way we are living our lives, something that has happened in the past 20 years, that there is a phenomenal increase in autism.
It sounds like the environment is a contributing factor to autism. What about the genetics of the parents?
Yeah, so the genetics of the parents also affect it, but you have to understand, the same parents living in one continent, and when they're relocating, you're actually finding a higher incidence. You can have in a family, two children, one will be completely normal and one may have very severe autism. So the environment affects, but the environment sometimes affects through the mother. See, what we have to understand is that very often the problem in this starts in utero, when the child is still in the mother's womb, or shortly after. So and today we find that mothers are exposed. They're exposed to toxins. They're exposed to radiation from mobile phones and mobile towers. The diet is the diet has shifted. Earlier we used to have healthy home diet, and now people are eating outside. Mothers are working. Then we find, for example, mothers who smoke. There is a much higher incidence of autism in them. We are also finding that parents who have children later. So, say for example, a father who has a child at 45 years will have a 3.5 times greater chance of having a child with autism than a father at 25 years. And today you realize people are having children later. So the older the parents, things like smoking, then depression, diabetes. And when we talk of mother's health, our focus has been only on physical health, but the emotional health is just as important.
Emotional health, yeah.
Anxious, a mother who's depressed, a mother who's stressed out. Whenever we are under stress, our body releases stress hormones. Like one of them is adrenaline, and there are some other hormones. Now, if a mother is pregnant and stressed, where are all these stress hormones going? They are also going into the child. So the mother's physical and emotional, I'm emphasizing emotional health, is extremely important. When, very often when parents come to us, when we go to the histories, the majority of mothers say that they had a very stressful pregnancy. They were under a lot of pressure, family pressure, social pressure, so many other things. And all that also has effect. So there may be no one cause. It may be a combination of multiple factors. Okay, you may not be able to pinpoint a cause. There are many factors, environmental, genetic, that could possibly be causing this increase in autism.
Oh, wow. I learn a lot on these shows. Thank you so much for that explicit definition of autism and what may have caused you. You answered so many questions already. Now, let me talk to Sylvia, who runs AndySpeaks for special needs persons. You are an advocate and also a parent of autistic children.
Yes.
Tell us about your organization to start with.
All right. Thank you very much. And thanks for having us. As mentioned, Sylvia Mochabo is my name. I'm a parent of 3 boys, 2 being on the autism spectrum with a comorbid of epilepsy. So I started this foundation generally because of that, because life here in Africa is very difficult when you have a special needs child. Services and access for all of this is extremely strenuous. And it's like the neurodiverse family is a forgotten thought after everything else is done. So even when policy matters and all that is being done, we are not there. So I founded AndySpeaks so that we can champion for inclusion of persons with neurodevelopmental disabilities, plus their caregivers in matters education, health, and social protection. Because through the journey, now my son is going 12, the other one is going 10, you find that it has just been a struggle. You're forever fighting, you're forever trying to find information. You're like walking this dark path where no one wants to talk about what this is, even the doctors themselves. First of all, we get the diagnosis very late. Then you start running around. You've not even had time to absorb this. What is this? Why is it, you know? Then immediately you have your family already looking at you. Of course, it's always the woman being looked at like, okay, so what did you do? It's your side.
It's the mother's fault that my child is autistic. Yeah.
Exactly, because the men will always say like, we don't have disabilities in our family. So a good percentile of us are single mothers because of that. So you can imagine that, and you can imagine the pressure of getting service, and it's expensive. You know, people say PWDs are poor, but disability is expensive. If you look at the African setup, you have to live your daily life. Your child has, like doctor said, they are very dependent. You can't find good care because no one can understand your child as easily. If it's a nanny, you'll find yourself changing every other 1 month, you know, and these children need that consistency and they can't find that. So you find living a normal life becomes very, very hard. And after walking this path for a while, I was like, am I alone in this, you know? So that's why I started getting vocal about it. And I like the traction, the way things have taken for those who started before me and the ones who joined, because I said, I will put my life out there. This is what it is. Because sometimes you just talk, people don't get it. They don't understand because they can't paint the picture. If they don't walk your journey, they can't feel your pain. You know, the first thing is like, oh, you're a cast generation. There is something you did. There are people who've been told, oh, you must have cheated on your husband when you were pregnant. Or you must have, I don't know, done this, or your husband did this, or try cleansing. Let's go for prayers. And we're like, wait a minute, none of this is my fault. It just happens, like Doc said. And for me, he has given me an answer of, if I look at my pregnancy, it was a very tough period of time.
Yeah, it was stressful.
You know, I was dealing with my marital issues, and I am pregnant, of course, and all that, and very early in the marriage and throughout. Of course, you're not going to have it easy, right? Then the baby came early. So all these things that always surround us always contribute to what it is. But that cultural stigma needs to end. And that's why we're here advocating and saying like, hey, remember, my child is part of this community just as equally as yours. So if it's about having them included and integrated, let's have fair play and meet them at their point of need. Don't just say, oh, all PWDs are going to get this kind of support when you're not looking at what my child actually needs to thrive in this current situation. So yeah, that's why we're here, and that's why we make all the noise that we do.
We will talk a lot more about the taboo, the African culture surrounding autistic children and everyone with special needs. It's just, we have to start talking about that in order to wipe that, because like Doctor just said, there are other factors that contribute to it. You're not cursed. You didn't cheat on your husband. It's other things. We need to start learning more about this, and so we can talk about them more. And to bring in Winnie, thank you so much, Winnie, because you started this conversation with me about autism. You have a grandchild who's autistic, and getting help is really difficult. So tell us about that a little bit more. You're muted, Winnie. There you go.
Mabelle, first of all, is to thank God because of meeting you, Mabelle. And even the way you came up with, like, you need to hear more about autism. Myself, I'm a grandmother. I'm a mother of one baby girl called Salah. And Salah is the baby to is the mother to my autistic grandson called Kwame. So myself, I have come to see how these autistic children go about it, but it also affected me because my grandson was born in 2016, December 12. And by that time, I was outside of this country, Kenya. I was living in a country called Comoros. And I was very happy that now I'm a mother, I'm a grandmother, and I'm like, oh my God, I wish the day I'll see my grandson talking to me and telling me, oh, grandma, I was so happy. So by that time, I was not able to come back to Kenya. I came back to Kenya last year in 2020, March. And by that time I came, it's when Corona hit and I had to vacate Comoros. So I've lived in Comoros more than 4 years without meeting my family. That is my daughter and my grandson. So when I came, I was like, oh, Kwame, how are you? The child, I'm telling you, Mabelle,
Said nothing.
Not,
Yeah.
not even be able to, like, I hugged him and he calls me like my grandma. In fact, he was running away. I was like, what's up? I was happy. I wanted to hug him. I wanted to give him my gifts, the one I brought for him. But my grandson, who was now more than 4 years old, could not speak to me, could not even come near to me, could not even, it was hard, Mabelle. So I lived with my grandson since last year. And in fact, by August, already depression had hit me, stress, anxiety. I had to go, Sylvia, you know very well, even for treatment in Madare Hospital because of that depression. And it was caused by my autistic grandson. Me, I knew there were children who are born retarded or something like that, but this was too much, crying of the child at night. I want to hold him to cool him up. The child is not cooling down. The child is not eating what I think he can eat. I'm unable to know what to do. Even the mother now, my daughter is stressed. She's working. We are not sleeping. So my brain was like it had been overworked, but I didn't know about it. Trying to find all sources. Sylvia, I even came to meet Sylvia because of that, because I was searching up and down where I can get help. And even to now I'm talking here, I don't still have the proper, the way this child can be helped, because the child is spending 24 hours in the house. We don't have yet somewhere when we try to go to KISE to take him for the grow program. It's a process. The child is like the forgotten one. He's just not playing outside with the other kids. So I'm here as a grandmother. I'm here also as a volunteer because I am an international frontier. I have even my world award, an international award, Peace, Books for Peace, for supporting children. I support children in prison, children with disabilities, and now I have my own grandson who has autism. So I'm here, doctor, to hear more about you, to hear even well-wishers who can even help us to support these kids, because they have so many basic needs: the diapers, the food, even there are no jobs. The mother is jobless. So I'm here to hear more about autism, to know what we can do, even to help other people who don't know how to go about with the autistic children.
Wow. Your story is very intense. Doctor, it's unfortunate from what I've heard from you that we cannot even tell the signs until that child is 2-3 years old. In her case, the child was 4 years old. How can we start telling earlier than that there's something not right with the child, so we can start seeking help early enough?
Yeah, so this basically comes from awareness and understanding of what exactly autism is. Because unless you are aware, see, what happens is very often there are children who tend to speak the average parent thing. They'll say, oh, this child will, he's not speaking at 1 year, he'll speak a little later. He will start doing things. So, but what we have noticed is that all mothers, every mother, is the first to notice.
The first
because
teacher to their child.
Know that something is not all right. All right. But not being medical, they can't pinpoint it. And the love of a mother, you just assume that it's all normal. It will improve spontaneously. So, but just now, of course, if a parent has an earlier child who's normal and the second child has autism, they tend to pick it up much faster because they actually notice the differences. They notice that the earlier child had started speaking at this age, didn't have the behavioral issues. So, and a greater awareness, and that is what, your program, your radio program will do, is a greater awareness that when children are born, we need to be conscious. What is it that they can understand? Okay. What is it? How are they processing information? So if the brain is like a computer's got three parts. There is an input. There is data that is inputted, which is our visual, our hearing, our touch. Then the brain processes this information and then the brain gives an output. In children with autism, the processing is weaker. Okay. So although the inputs may be normal, but they aren't able to process it. So just understanding that they are processing information slower. And this may have to do with speech, it may have to do with behavior, it may have to do with education. If we can just get it, this is slower, there's something not all right. And early intervention is very important. The key, the success to the treatment of autism is early intervention. Because our own data, and we've treated now more than 3,500 children of autism with a combination of treatments, and our data very clearly shows the earlier you treat, the better results you get. We've actually shown that autism can be almost completely reversed with our combination of treatments that we are now using at our institute. So it is possible to reverse autism, but you have to do it early. We have found that when we treat children below 5, we get the best results. And then as the children get older, the results, they're still there, but the results are a little lesser. So also with greater awareness, we need to investigate. So very often what happens is doctors make a diagnosis and just leave the child and tell the parents, like Sylvia and Winnie, okay, just take rehabilitation, nothing can be done. I think that is the worst thing because, once you tell parents nothing can be done, you take away all hope from them, right? And once you take away hope, there is nothing. Now, Sylvia here is, motivated, determined. She set up a foundation and she's doing all these amazing things. And, Winnie is doing great things for grandchildren. But every parent doesn't have the resources or the ability to be able to do all of that.
Yeah.
So awareness that number one, and that autism can be treated. Okay, there are several publications all over the world now that are actually showing that if we intervene early and use a combination of what we call cell therapy or stem cells, along with rehabilitation, along with certain oxygen-based integrative therapies like hyperbaric oxygen, you can completely reverse, the damage in the brain. Now, what is happening right now is that once the diagnosis is made all over the world, we are not even looking at their brains. No scanning is being done. You'll be surprised that most of the time, they don't, the brains aren't even scanned. And there are special scans now called PET CT scan, positive emission tomography, which are color scans, which actually show you very clearly which parts of the brain are not working in these children. And we have done about 3,500 such scans, and we have shown that every child with autism, every single child, has certain parts of the brain that are functioning less as compared to other children. And we've done these scans in normal children as well, and normal children don't have that. So we've actually published this in a scientific paper showing that these parts of the brain are not working appropriately. Now, once you know what part of the brain is not working appropriately, you can actually treat it, you can fix it. So my message to the world is autism is to be treated like any other medical problem which can be fixed. And fortunately, it can be fixed with very simple methods. They don't require any intervention. They don't require, nothing major, nothing like a brain surgery or anything else. So very simple. We've actually shown, the damage before, and we have done the treatment, and 6 months later, we've done the scan, and we've seen that, the damage is not there anymore. And we of course pioneered this treatment, but now this treatment is happening all over the world. And now it's even available in America. I mean, they've started at one of the universities there, they've started this treatment. So it is picking up, but this treatment is developed more in the East. So India, China, Japan, Korea, Asian countries have been doing more of this as compared to Western countries. Because your mind will be wondering, if this treatment is available, how come it's not available in Africa?
That's my next question. What are the resources in Africa? We have to go to the Neurogen Brain and Spine Institute to get the treatment. What's going on?
because in Africa and looks to the West. So the moment something is available in America,
I
go
agree.
to any African and they say, is it US FDA approved? Once the US FDA approves, the whole world approves. Unfortunately, this treatment is not developed in America. It's coming now. I mean, now there is, they've just about started doing it now. We've been doing this for the last 13 years. I've been doing this since 2008. So that's the reason. Although thousands of patients have been treated in Asian countries, It's not picked up as much in Africa because Africa looks to the West. It's just something
That's how it
colonial.
is. Yeah, that's how it is. Colonialism still hits us that way. So let me stay with you a little bit, Dr. Sharma. So referring to Winnie's grandson, who cannot even say a word, can't even welcome grandma, if you had to treat him, what can he do? So my question is, the track record from your institute, the child who could not even say a word, cannot say welcome grandmommy, cannot even communicate with other kids, what do they do after the treatment? Do they become completely normal, or they can do some things to some level?
So again, it all depends on the age of the child. Right?
Okay.
What we have seen is that those kids who are below 5, they get back, they become what we call, so over here we don't use the word normal, we call them neurotypical. It's a medical term for what is normal. Every child we've treated below 5 is now become neurotypical, every single one. All right. Those who are between 5 and 10, before actually puberty. So we found, puberty, that's the time when a boy becomes a man, like develops a mustache, develops sexual organs. Those who are treated before puberty are the next best group. So almost all of them, are now going to normal schools. They're independent for the daily activities. They're not dependent anymore. The majority of them have gone off the spectrum. But then once they cross puberty, for some reasons, because in puberty there's a flush of hormones, testosterone, the brain becomes a little different. The results are lesser moment they cross puberty. There is a big difference. They still improve, but the results are much lesser after puberty. That's why our entire focus is early intervention. Okay, we can reverse autism, and I'm saying reverse autism. I'm not saying reduce it. I'm saying reverse it, but we have to treat it in time. Early intervention, and we have to use this and there is no one treatment. It's a combination of treatments. So one set of treatments is something called stem cell therapy. Although that sounds big, really all we do is we take a needle, we put it into the bone, that is the pelvic bone just above the hip bone, and we take out the liquid in the bone, which is called bone marrow. It's a 15-minute process. You understand? Take a needle, put it in the bone, and take out the liquid in the bone called bone marrow. This bone marrow is taken to the laboratory where it is sort of filtered and the stem cells are removed from it. And once we have the stem cells, then with a very thin needle, we inject it into the spinal fluid in the lower back side. Why the spinal fluid? Because the spinal fluid goes directly to the brain. So when we inject it below, it directly goes to the brain. That's all. There's just 2 needle pricks. With one needle prick, we are taking out bone marrow. And with one needle, we are putting back stem cells from the bone marrow. We are taking cells from the child and putting it back into the child without. So this is natural. This is natural healing. This is the way God had meant the body to heal, using our own good cells, to repair the damage that has been caused with no surgical intervention. There is no cut, there is no stitch, there is nothing. It's a simple process, 15 minutes to take out and another 15 minutes to inject. And there's a gap in between when we actually separate the stem cells. The beauty of this treatment is it's a very, very safe treatment. So we've treated more than 3,500 children with autism. We've treated another 3,000 odd of cerebral palsy. Totally, we've treated more than 10,000 patients from 70 different countries. And it's a very, very safe treatment. There are no major adverse events, side effects. We've not had anybody who after the treatment has become worse than before. Because what are we doing? It's 2 needle pricks, like how you collect, how you take blood out for blood collection. So taking out blood for bone marrow and putting the child's own cells. I keep emphasizing that there is nothing from the outside. We're using cells from the child, putting it back in the child. So, but along with this, so we have found that this helps in repairing the brain damage inside. But along with this, rehabilitation is extremely important. So a combination of occupational therapy, of speech therapy, of behavioral therapy, psychological therapy, special education, art-based therapies, aquatic therapy. So we found that, let me make, it's like if the brain is like a computer, a computer's got hardware and it has got software. Stem cell therapy fixes the damage in the hardware. Stem cell therapy does not software. So once the damage in the hardware is made, now the therapy is put in the software.
That's a very good way to explain it.
the therapies are extremely important. People think you do stem cell, my child will become okay. No, that's just half the job. Okay, if you can have the world's best hardware, but if there is no appropriate software, there isn't going to be a response. What was happening was, up to now, earlier, we are trying to put software into damaged hardware.
Yeah.
The example I give is, imagine, if your leg is fractured, your leg, bone of your leg is broken, and I force you to run, or I force you to walk, or I keep making you do physiotherapy on a broken bone. Will you be able to achieve results? Obviously not. The bone is broken. But if you go to an orthopedic doctor and he fixes it, he puts a plaster, plate, screw, joins your bone. Now, when you give physiotherapy, now you will be able to, walk, run, do whatever you want. So what we are doing now is we are giving rehabilitation therapy on damaged brain, which I believe is so unfair, because the children cannot, when the brain is damaged, they cannot do the things that we are expecting them to do. Just like you cannot walk. You're the world's best athlete. You may be Olympic gold medal winner, but if your leg is fractured, you can't walk, you can't run, you can't stand. So we have to fix the damage first, and that's what stem cell therapy does. But then rehabilitation is equally important. And what we are now finding is that when we combine these two with, there's another very exciting form of treatment, that is oxygen-based therapies. But one particular type is something called hyperbaric oxygen, which is very, very simple. There's just a chamber. The mother and the child just go inside and you lie down, and there's a nice TV with cartoons the child can watch. And oxygen is given under high pressure, so that oxygen then goes into the deepest parts of the brain, and it helps in a faster recovery. So what we are now finding is that when we give stem cell therapy combined with rehab with these oxygen-based therapies, hyperbaric and certain other combinations, we are getting the best results we've seen in years. Children who are unable to speak have started speaking within months. Their behavioral issues are getting resolved.
Oh wow!
They're able to do things that earlier were
more socially interactive.
They're socially interactive. They're shifting from special school to normal schools.
Wow!
I've got kids who could not speak who are now speaking in 8 languages. Can you imagine? A child who had no speech. We have this child from America who's from no speech is now talking in 8 languages. I mean, and that's so completely amazing that
amazing.
A child. Yeah. So this is all documented. All our work is published in scientific papers. So we have over 100 papers, 107 papers to be precise. The world's first scientific paper on the role of cell therapy in autism was written by us. The second paper came from China. The third paper came from Italy, and the fourth and fifth have come from America. So we are sort of leaders in that. But my wish is that there should be greater awareness of this.
Yeah, so that's why we're talking on platforms like this. Yes.
That I'm just hoping that doctors in Kenya, doctors in different countries in Africa, and they hear about this and they plan to start these treatments. And we offer free training. I mean, anybody who wants to start is welcome to come and learn from us. And there's a stem cell therapy center in Vietnam where they send the entire team. We train them, and they've gone back and they've started the whole.
They're doing their own. Yeah.
We're happy to train people because there's only so much we can do. There are only 7 days in a week.
We need to spread it out there.
70 million kids with autism. Unless each country starts doing it themselves, we are not going to move ahead. There are too many children. And the important thing is, the earlier you treat, the better. So these kids don't have time. If I could treat a child today, I can get a very different set of results than if I treat them after 3 years. It's like any disease. It's like cancer. You treat cancer early, you get much better results. You treat cancer late, advanced, in the same patient, you don't get good results. That's true of anything, whether it's diabetes, whether it's kidney disease, it's heart disease. The earlier you treat, the better results you get. Fundamental principle of medicine.
I agree.
Our children don't have the time. Okay. Yeah. And we can't be waiting and doctors saying nothing can be done. We have to be aggressive. And that's where the role of Sylvia and her foundation, AndySpeaks and DCP Kenya, because governments listen to people, they listen to parents, they listen to the messages from the ground, and that I believe is what will make the difference.
It is. So Sylvia, from what Dr. Sharma has just said, what kind of resources do you have where you are in Kenya, for your children and for others who have special needs?
or resources is one thing we're always fighting for, because even if you go to a public hospital, you will find they say, oh, we have therapy. We walk into the therapy room. The only thing there is a doctor with a massage oil. And you're like, okay, where's the therapy? You understand? Well, it needs, like the doctor said, it's very intense therapy to support. But
and the therapy comes after, right, Dr. Sharma? It comes after the treatment has been
after diagnosis.
Yeah.
First of all, like
you're saying, it's not available at all. I mean, it's not there. It's not there before. It's not there after. It's just not there.
Yeah. It's not there. And you look at what he mentioned about 20 years ago, autism was not even in the textbooks being talked about. Even now, our education system has
still don't have it.
Updated, So that means identifying it, he said the 3 to 4, we're still at 7 to 8. And then he's talking about intervention below 5. What hope are we looking at over here? You see, so that's why we're saying we really need to talk about it, so that parents who've not yet given birth, parents who are going to give birth or have already had children, can pick it up themselves and actually do something about it. Because that's the only way we can only help ourselves at this point, and also talk about it and hope that the government can interject. Because I know even in the places that I sit in, that's what I'm pushing for. We need inclusion. We need systems to change, We need this to be talked at levels where, if it's high school, change the syllabus in in our colleges, so that doctor, that nurse who's first handling your child, will be able to identify and not feel and flinch and be like, I don't want to be the bearer of bad news. You're hurting me. You're denying my child an opportunity because you do not have the guts to come out and tell me. You're doing me a disservice as a servant or to the public. You're doing me a disservice. You'd rather tell me and just lay it out to us gently. So services even going around schools. I've had my child in school, but with COVID, schools are not taking our children because he can't put on a mask. I've been looking, and all the ones that are saying they can accommodate, they're just not affordable. We have to be realistic. We have medication, nutrition, and then now education, which is very expensive. And I know I've heard about Next Gen several times. Even we've been talking to government and saying, like, can the government health service support us to get our children these services? It's not yet approved, you see. Wow. So if I can't fundraise, if I can't afford it one way or another, as much as I would love, I would do anything for my child to get this.
Absolutely.
I have to fly him to India. I have to think of how he's going to stay there. Look at me with 2 of them. Everything we're talking about, I look at it on the double. All the services, because you're looking at the issues you're going through, and you have to think of how much is it going to cost me. Flight only, I have to go with the 2 of them and probably have a minder, because it is a lot. And you get there, you have to think of accommodation, then the process itself. So not that we don't want the support, we can't afford it, And for me, what breaks my heart is to hear that now that my son is a preteen, it's like my hope is dwindling with each day.
Yeah.
So it's one of the hardest journeys. And as much as you put yourself together and we stand out there, every day you
emotional.
Every day you go back, you look at your child and you've tried. I look at all the things I've tried to do, and you ask yourself, how can I split myself to be out here, to be there for him, to give him the best he needs, and at the same time provide? Because as a single parent, bottom line, you have to provide, So that's the point. You're like, something's got to give. Which one do? So we're trying to change the system so it's more accommodative for our children. At least those ones who have passed already, and we're doing the best we can, but the gaps are crazy. The gaps in health, social protection, and even in education, the gaps and the services are just not easily available. And if they're there, it's by name. They're not well equipped to cater for it. We have had, if you look at the levels of, I know we're talking about autism, but if you look at the levels of cerebral palsy in our country, out of doctors' negligence, it's skyrocketing. Just because now these days you can become a doctor because you pay for the paper. You understand? So, and people are not seeing that. We have parents suffering, we have children dying because of some small things, and just because someone put monetary benefits before human life. So I think we need to get back to our roots, where some things are more important than others. You know, where we think about the community at large, where we think about the person next to you, and not just what's in it for me.
For me,
as
yeah.
an individual.
Yeah.
Yes, then that way, when you think about everyone and what everyone else needs, maybe we'll see some progress, you know,
Maybe.
especially in integration. And because one of the hardest things we have as caregivers is the stigma our children face. It's crazy. It is insanely crazy. So that's why you'll try and see that you want to do something, you want to go out, but you think of the pain because the parent feels the pain. My child will not understand why someone is behaving. You won't feel the emotional pain. But for you as a caregiver, it kills you, it breaks you down to pieces. So sometimes you're just like, we'll do our own thing over here, like you guys.
We're not going over there. Yeah. Inclusion is a big thing. It's a big thing.
Yeah,
it's a big thing. Winnie, what about you? What about the resources that you have available? I know it's the same country, but what's your community like your immediate community and the resources that you have for this? Are there any?
Mabelle, actually, about resources, as Sylvia is talking about, it really brings us down, especially at a time like this of COVID-19 pandemic season, where even those who had jobs are jobless, where even those who can learn to ask even for support, they don't have anything to support. They have the sympathy, but they don't have anything to support these children. Myself, I've tried areas, I've tried relatives, I've tried friends, and I'm like, I don't know what to do now, but I'm happy that I met you, Mabelle, because now we can be able to know if there is anybody out there who is ready to support these kids, who is ready to help, to give a hand, so that what Dr. Sharma is telling us, we can have another intervention. For example, my grandson now is 4 years, 8 months. That means now I'm worried. He's now almost the 5 years that Dr. Sharma is talking about. And he has said that this early intervention is the best result which can bring the best results to the kids. And when the child is after 5 years, well, he is saying that the child will still get the results, but they will be lesser. And he has given good examples, like those who are cancerous, that those who have diabetes. We all know that if at all cancer is treated at the early age, it is better. If diabetes is treated, even people go back to normal life. But now resources are bringing us down. They are actually bringing us down, because when we don't have anything to plan about, even that money, you cannot say that I have money, I know what to do. The only tricky thing about this autism is that we don't know, like rushing even to the hospitals, whereby even you can say, okay, I can even get a debt so that my child can be treated. This is nothing. There are no insurances for autistic children. There is nothing about where you can get these resources for these autistic children. So what I'm asking everyone is that, dear ones, let us hear from the doctor. Let us have the planning, because I believe in planning first, and money comes second. If at all we talk about the resources, when we don't know what to do with those resources, we will also get lost, and we will not give the child what the child actually needs. So what we need now is what we are hearing from the doctor. We have the planning, and then we find the resources second. There is also another thing. Feeding programs for these children. It's a great issue, because the food they are eating is not the food that other children are eating. There are some foods that even my grandchild has been told not to use. He has been told not to take milk. He has been told not to take wheat. He has been told not to take anything to do with sugar. So all these things, now you have to go to another budget that you don't have. And this is where we are crying we are getting depressed. We are getting, like now it has affected me. It has also affected the mother. And also there's something Sylvia has talked about going to be a single mother. I have seen that those children, those mothers who are having autistic children, they are being abandoned by the other parent. Instead of bringing up the child as a father and a mother, the father, when he sees the child is autistic, the father disappears. And
it's the mother's fault.
Yes, carries the burden. And now that burden of bringing up an autistic child is too burdensome. And even now, you see, it brings down the relationship between the mother and the husband, and even the child. Like my grandson loves the father so much. He's like, always daddy, dad, and he's like, you see, he's like, Mama. He's like trying to call even somebody like Baba. In Kenya, Baba is daddy. He's like even trying to say that, but he's nowhere to be found. So it is also causing those disintegrations in the family. And if at all we can have the early intervention, as the doctor is saying, I believe these are kings and queens of our countries.
They are.
And I believe with what we have started today, the lives of our autistic children and grandsons will never be the same again.
Never. Thank you. Sylvia wanted to add something to that.
Yeah, now you see, when we are in a situation where everyone is for themselves, so you find ourselves as the caregivers, we have come together and we're trying to also, just interject to take care of our own children. So we run projects like during COVID, we realized, especially children who are autistic and with cerebral, just the neurodiverse community, we were losing kids through lack of access to bare essentials like anticonvulsants medicine. No one ever talked about it. We just have it in hush tones in the groups. And even the medication was not available in the country. We had to go call out media and try and point this out for something to be done by the ministry. We were asking, the prices also quadrupled. We're asking why. It's essential medication. It's not available, and where it's available, it's like gold. Today it's there, the price is skyrocketing, and we have to buy it for our children. So I know as an organization, we did a fund drive for this medication. We still have people asking. I know Winnie asked about this one some time back, but as we do not have the funds anymore because COVID hit everywhere. We cannot afford to support even the small families who need it very much. The other thing that we are doing with the awareness is that we usually do autism awareness every year, where we ride for autism awareness, and then the process we try identify a center where we're trying to set up therapy centers and equip it and properly equip it at schools, because we want to have it that, like doctor said, if you don't have the intense therapy, even if you take the child to school for how long, it's not going to work, right? So we're trying to talk to government to set up a sample, like, hey, watch this. If we have therapy as part of our classes, that it's going to work, because we've seen that is how it supports, because there is only so much you can do at certain points, and that's what we're trying to do as an organization. And we hope that at least we'll be able to keep at it and also see that there'll be change. But the government itself does not support you sometimes, it makes it very, very difficult, especially in the matters health, because that is the one thing that goes hand in hand. Yeah, it is a rights issue. Disability is a rights issue, but it was also before a medical issue. It's just that now it is a basic right, the same way my health is my basic right. So I will call upon our governments to just, wake up and do something. There is no minority. The minute you help this child, they're going to be a resource to the government. How many savants do we have? But they're rotting away because the education system, and they don't have that opportunity. No one has space for that high intelligence. You will be branded as weird instead of people identifying and embracing that. And that is a resource that we let to just go away. Those are some of the challenges that our systems need to wake up and see the positives, and we stop focusing on what they can't do. Like Doc said, the child went through the treatment. Now they can talk 8 languages. If their parent hadn't taken the step to do this, then what? It would be just another loss, which is a resource to the country. Yeah.
Now, Dr. Sharma, I was told you have some slides to share with us today. before we tackle the last segment, which would be the cultural approach that we have in Africa. Why do we consider people that have special needs as bewitched or the curse or something? Before we get there, do you have the slides you want to share with us?
I'll just share with you some slides. Most of the things I've spoken, but I'll just, with the visual, it's a little better. Can you see the presentation?
Yes.
All right. I won't go through the whole thing. I'm going to run through a little fast. So
Okay.
what I basically want to show was that what works is a combination of the cell therapy, rehab, and integrative. So I want to remember it's three. And the example I give was, this is like a broken bone. And would we give rehabilitation on this? We would not, right? We would put plates, screws, and fix it. But this is what we are doing to our children with autism. See, this is a brain scan where the blue is damaged. We are giving them rehabilitation on damaged brain. What if we could regenerate the brain like this?
Yeah.
Make it again. Obviously the rehabilitation would have much better results. So the old thinking was that the nervous system does not regenerate, but the new thinking is that some amount of regeneration is possible.
Yeah.
So basically the word stem comes from the stem of a tree, and just like a stem of a tree gives rise to branches, leaves, fruits, etc. You have some cells which can give rise to any cell of the body. So stem cells, their qualities, one is they multiply, second they convert. That's the most beautiful part. So we take the same stem cell. It can become a brain cell, a heart cell, a muscle cell, depending on where you put it. So that's the beauty of the stem cell, that it can become whatever you want.
Anything,
and this is just to show you, this is from our own research. This is not from the internet. This is what a stem cell looks like. And when you put it back, these are all brain cells. So you can see that the stem cells have converted into brain cells or neurons. So now we know that stem cells convert into brain cells. They also release certain growth factors in the body, and they improve blood supply. So I'm just going to skip all of this. And so this is basically what we are doing is we are using healthy, good cells to replace the damaged cells. So here you can see, the blue is the damaged part in a child with autism. You give stem cells and you can fix the damage. The stem cell therapy has got the Nobel Prize. The Nobel Prize is given this week. You may have been hearing.
Yes.
3 times, 15 years, the Nobel Prize has gone to stem cell therapy. And we ourselves have published, like I said, over 100 papers. And this is now there are international textbooks. This is a book on autism. And you can see that there's a chapter in this stem cell therapy in autism, which they asked us to write. And there's a book on cerebral palsy, where again, the stem cell therapy chapter we wrote, physical disabilities, etc., muscular dystrophy. I'll just run through also. This is just to show you how the treatment is done. Small video. You can see this needle, and this is the bone marrow coming out.
Right.
And then we take it to a laboratory where we separate the cells, and with a very thin needle, we inject it back. Right. So as you can see, just 2 needle pricks. With one we took out, and one we injected. And I'll just quickly run through this. We all are familiar with, so I'll just come to show you some of our results. So these are our results. This was which showed that 33% of our patients had a significant improvement. That means the autism was completely reversed. Like I said, all these kids were pre-puberty. In 29%, there was a moderate improvement, 20% mild, and 10% didn't improve. So this was between 10 and 20 years, and all these, they were over 20. So there's a very classic thing that if you treat early, you can reverse the autism. The later you treat, the lesser results you get. And I'll just end. Okay, so this shows you the chain. Now, above is the brain scan of the same child. This is a top view, a front view, and a side view, and whatever is blue is damaged. Can you see? And below, the same child 6 months after stem cells, and you can see this damage is complete. Look at that. This is objective proof. And I'm showing you one or two. I've got 3,500 scans that show that the damage before gets completely resolved. Just to show you another, you can see the blue is the above is before stem cells, and afterwards the damage is gone. Again, you can see the above is before stem cells, and afterwards the damage is gone. And this over the years, when we do it serially over the years, we find that the improvement continues. Whatever improvement is there, it sort of continues. And like I said, the world's first scientific paper was published by us. This is our paper. And the second paper came from China, the third from Italy, and the fourth and fifth have come from the Duke University in America. Yeah. So that is just, and we have published several other papers. And here's this, just to show you this child, just last couple of seconds. This. Okay, I'll show you. I think we'll show you this. This is a story of 3 triplets.
We went to different doctors.
So this is, we understand having one child with autism, how difficult it can be. Sylvia has 2 children.
Sylvia has 2. Yeah.
Here, this is just a small, very 30-second video of a mother from Nairobi who had 3 triplets. All 3 had autism.
Wow.
And how this mother managed it, just let's very quickly have a look at that.
Sure, no problem.
Doctors, we went to different hospitals, and when I brought it up, they were like, oh, no, don't worry, it's because they are boys, they are triplets, they were premature. I would be walking out and I'm like, bye, and no child is crying, no child is waving back bye. And by then, for sure, I knew that they should be doing that. The children had this behavior of disappearing. In fact, Eric disappeared 3 times in the middle of the night. The biting, the spitting, the scratching. How are we going to stop this behavior? We went to see the neurologist, and in 5 minutes, he said, these children are autistic.
As parents, it was very traumatizing. First of all, we didn't understand what autistic means.
So I decided to really get to read a lot about autism. I remember the first time I read about stem cell. I was like, wow, this is really good.
We had a lot of questions which we asked, and we got very clear answers from Dr. Sharma.
The day of the stem cell itself came, actually, I was a bit anxious, of course, but really I didn't have fear. A bit of apprehension, anxiety, of course, as a mother, but I knew they're in good hands.
We put a needle in this pelvic bone, and then we take out the bone marrow, which is the fluid inside the bone. The pure stem cells, once they are ready, a thin needle is inserted into the lower back. We inject the stem cells into the cerebrospinal fluid. It flows all the way up to the brain.
Things that would have taken probably years to be accomplished in my sons, in like 8 months' time, we've really been able to come very far.
They used to defecate on their clothes, but now they can use the toilet. We've seen a lot of improvement in terms of spitting. The tantrums have reduced. Sleeping used to be a problem before, but at the moment, he's taken to his bed, it takes a few minutes and he's asleep.
You see my son cycle. You try to make them understand what it is to pedal, and they couldn't. But after stem cell, when we arrived in Kenya the following day, and we went out, and these guys could cycle. I'm going to send you to buy tomato paste, okay? I'm going to send you to buy what?
Tomato paste.
In the shop. Where is the shop?
It's here.
Okay. So I'm going to give you
Money.
for what?
Buy tomato lollipop. I'm going to wear my shoes. That's right.
Parents ask me, so do you really think stem cell works? And I'm like, I can see changes, I can touch, I can feel, I can smell. Of course, for me, stem cell works. I'll do it until my children get well.
video. So, and by the way, this movie is
Wow.
It's about almost over 3 years old. And
Wow.
all these
I got emotional.
actually, they're going to normal schools. These kids,
Yes, they are.
speak. You heard them speak now after the stem cell. There was no speech. All right, this kid was
Oh
talking.
my God.
They are now going to normal school. Okay, I mean, but the mother has really worked hard on them. I mean, she has 2 other daughters and 3 triplets, and she has just worked so hard, single-mindedly. So the one single message that I want to pass on to all the parents and the families of with autism is: do not give up hope, because if we give up hope, our children have nowhere else to go. All right. And we have, a very brave and courageous mother here, Sylvia, and a grandmother, Winnie, but not all parents have that, because when they go to multiple doctors and they're told nothing can be done, somewhere inside they break, all right? And that is the one thing that should not happen. We do not give up. We keep trying, whether it is rehabilitation, whether it is diet, whether, it is the overall day-to-day training, daily activities, whether it's education. We have to keep going ahead, because there's just one more, something very important. What we have seen is all these kids, once they come out, they have some special qualities. They have these amazing special qualities. It may be ability to, in calculations, or it may be art, or it may be music, or it may be dealing with some chemicals or electronics. And it is very important once they start coming out of the spectrum to identify that, and then to develop that into a vocation, because once they get into that, they are right on top of it. So my message is, our children with autism are not less than, they are different. I want to repeat that. They are not less than, they are different. Okay. And once we recognize the difference, then we celebrate that difference. And then what we take is we identify what they have that is special, that is sometimes even better than us. They have these abilities which we can't even think or dream of doing. And the world famous scientist Einstein, he had autism. I don't know if you're aware of it, but Einstein had autism. Some of the biggest intellectualists today who've changed the world have had some amount of attention deficit disorder. These people have a brilliance that's unique, all right? And there's also something very special with children with autism. They have a simplicity, they have an honesty, they have a transparency. They don't know how to cheat. They don't know how to lie. They have a purity of thought, they have a purity of intention. Their love is so unconditional. So we understand these special qualities because we take them, and then they actually are a gift back to us and to humanity. They can give us much, much more than we expect them from. But it is important that we bring about the shift. And governments may or may not do it. Doctors may not do it. But parents can and will. But you have to keep that hope alive. And, organizations like AndySpeaks and DCP Kenya and your program, this is the difference that you can make. The audience who hears, for the mother who has been told that nothing can be done from your child, when she for the first time hears that something can be done, when she watches this video of the triplets, so, for the first time, she will sleep well at night knowing that something is possible for my child. Because one of the nightmares that parents have is what after us? Parents believe, okay, as long as we are there, we look after our children. But who will look after the children after us? And that is something that gives them sleepless nights.
Yeah.
But once they know that there is hope, and it's not just stem cells, I'm not talking about stem cells, aggressive rehab, integrative therapies, diet, all these things matter. But the important thing is not to give up. I mean, that's my one single message, that our children are not less than, they are different.
Yes, even with autism, they are not less than, they're simply different. I know we're running out of time, but I want to talk about something real quick before we leave. The approach that you get in the community, Sylvia and Winnie, about your children and your grandchild, as far as the African perspective is concerned. I don't know if it's lack of knowledge, but there's something. I grew up in Cameroon. I now live in the United States, but I am a full-blown Cameroonian, came here as an adult. But we have this culture across the continent of referring to people who have special needs as, oh, they're cursed. Oh, go check out your great-grandmother's grave and see what happened. Oh, go for some cleansing. Sylvia, please address that for a minute.
Prayers. You've been told to travel across, go to Nigeria, go to all these places. I have heard of a preacher here. It's the story of our lives every day when everyone thinks they have a solution and everyone thinks autism is a disease, you know. And yes, we know it is a condition and it's a neurodevelopmental. Yeah, there's so many people who take advantage of our situation right now, you know, trying to con them here, lie there, and take advantage, which is very, very sad. Even before that, acceptance, even how our own doctors deliver the message, you know, and like the doctors say, don't give up hope. But you know, we are always crushed before we're even given the opportunity. Because one of the first things after diagnosis, especially for our fellow CP children, you'll hear your child will not amount to nothing. Just wait for them to die at 5.
Oh my God.
You know, that's a doctor telling you that. There's so many stories we've heard. You know, some people will tell you this is not a child. I don't even know why you want to continue. You know, you should just get rid of it. We have cultures that actually support. We have cultures here, especially our Nilot friends, the nomads, where if a child is born disabled, the baby is put at the entrance of the cowshed. So the cows will be allowed to leave. If that child is run over and they die, then they say that child was not good enough for the world. But if that child survives, they say the child has a purpose. That is how deep-rooted the stigma is in our country. That's culture. Once you already have the child and you have your diagnosis, or you walk out with your child, the stares that you get, you know, then people looking at you like, okay, so what happened? What did you do wrong? Because it's always that. That's the one thing that everyone will ask you. What did you do wrong? You know, who in your family is a curse? Who could you check in your family or something where if someone else has it? Or if not, then you need to find out who did something wrong that the gods have decided you will pay for their sins. And you think and you're like, holy Jesus, I was not even in existence in those eras you're talking about for me to start looking back into historical background to try and figure out what someone did that this is falling on me. You know, that's the culture and the stigma that we have from very, very many different, but the bottom line is our children are considered more of a burden. There are those parents out when we were doing outreach and awareness. You identify an autistic child who's been locked up, you try and give diagnosis. Then the father themselves will be like, I don't want to hear about that story because my husband will leave me the minute we put a brand to it.
So there's denial as well.
There's that denial because you're trying to hold on to the marriage. You're trying not to be left. You're trying not to be labeled, you know, because the minute it's told your child has a disability and this is it, you know, they feel like, okay, from there they'll just be sort of excommunicated. You understand? So you're trying to balance your sanity, your reputation, you're blending in into society. But that's mostly if you go to the rural. In this day and age, what you find the more educated will just simply not take their kids out in public. You know, they can afford private tutors, they can afford home therapy. You know, someone told me we went for a funeral next door. This grown man walks in and we're all looking at you like, who's this? And that's when they discover there was an autistic child who has grown up their same age, is a fully grown man, and no one knew about it. That's the level of shame that people have because of having an autistic child. And I'm like, there is nothing wrong. Like the doctor said, there is nothing, they're just different. So can we just focus on the ability and not the label? Yeah. Let's see the able and not the labels. Simple. And nothing will change because that gives you an opportunity to give this child the best life they can get. Once you embrace it and accept it, because it is one of the hardest things, speaking as a parent, embracing it is the hardest step, because the other thing is if you don't, you can't move forward because you will keep wallowing on the why me, what did I do, and all this noise from everyone else, instead of trying to salvage your child and try to give solutions that will give them a better life and a better opportunity. You see, so that's why awareness and advocacy is such a big deal, so that we are able to have early intervention, we are able to be listened to, we're able to be included, and facilities to be set up. I'm very happy to hear that actually it is open, that someone here can set up a stem cell center and make our lives easier. Because you see, if you cut the flight, it will be more affordable. If you cut the accommodation that's so far, if it's easier here at home, it will make it more accessible for us who desperately want to change the lives of our children. But sadly, the economic situation cannot allow, you know. And right now, especially with COVID, even if you say you want to do a fundraiser, trust you me, when people already look at you at that lens of this child will amount to nothing, you're already halfway cooked, you know. So it's all upon you to try and figure out how you're going to sort it out. And that's not something that many of us can. So we'll die of depression, we'll die of stress, because you're trying to run up and down to give basic needs, yet you really want to give the best, but your hands are tied. So let's just embrace the difference. Let's
embrace the difference.
Yeah, that is
let's
it.
Embrace the difference.
Love and acceptance. Nothing more do they want from us. Just that. Thank you very much.
I had a show most recently on sickle cell, and one of the guests on the show who was 40 and sickle cell patient, she now has 3 children when she was told she would die before 16 and all that. And her parent had 6 of them, 4 were sickle cell anemic. They did not know that. You know, but just from what you just said, I remember when she said that somebody told her mother to take those children and dump by the river so they can all be eaten by the sharks because they're worth nothing. But advocacy is what she's been doing, and it's changing lives. Today, she's 41 years old and she speaks about it like nobody. We need to address the stigmatization issue that you face with your grandchild being autistic.
Yeah. Now, the grandson being autistic is actually a thing of what Sylvia is talking about being segregated, about looked at as if you are bewitched. In our culture, in our Kikuyu culture, we have the notion that you are bewitched. Somebody bewitched you so that you can have such a kid. The others will say you are dowry. In our Kikuyu culture, they talk about the dowry. Oh, you are married, but you did not pay the dowry. That's why you are seeing your child is having an autistic child. The other one is about the inherited. It could be the way Sylvia is saying, there is somebody in your family, those generations that had that thing, and it has come back to you. It is a curse. It has been said it's a curse. So these things are actually bringing us down, and the way Doctor has talked about and the way we are also researching, we are knowing that actually we have even read about those people who have been treated earlier intervention. We have even politicians in this country. We have very good accountants in our university here called Strathmore. The accountants and they are autistic, because when they had the early intervention and they were shown on the direction that they want, if at all like the child want to be an accountant, the child to be a musician, they are shown that direction. Actually, they are doing the best, according to what the doctor is saying. That's why I call them the kings and queens. They are people who can actually transform this world because they are genuine. They are people who cannot cheat. They cannot lie on you. They say what they want. And that's why I think even they scream when they see that you are not doing actually what they want and they cannot be able to talk to you. Like my grandson. The other day, Sylvia, you can even laugh at it. I said in the group, my daughter came with my grandson in town, and my grandson was like, he's crying at the highest of his voice. And here in Nairobi, we have the problem of the hawkers looking around because of the police for the city coming to arrest them because of the merchandise, selling the merchandise around. We call them Kajo. And then they thought, wow, Kajo has come. And that was my grandson screaming. Yeah, we had to laugh. He was like, so they usually do that. They attract even attention. That means even my daughter the other day, she said that I was very much happy about it. These are people who can even attract people to themselves for great things in this world. They can make even this world change, if at all they can be given by us, the adult persons. Because us, the adult persons, and it's our responsibility to give these children what they need. And not only the autistic children, all the children, they need the adult persons to care for them, because they are the future of our countries. They are the future And these are the future leaders. They are the future of our countries. When we'll be old, like myself, I'm a grandma. I need my grandson to look after me. I'm amazed. And I know he'll be like, oh, I want my grandma to have what she needs. So I'm like, this is my Isaac, according to the Bible. And my daughter actually, she's called Sarah. I look at even in the biblical way. Sarah has my Isaac, who is actually, I know with time, Kwame will be very new. Kwame will be treated and Kwame will become normal. And he will one day talk to me and tell me, thank you, Grandma, because of going for my intervention, looking for doctors all the way from India, looking for Mabelle from America, and Sylvia, the campaigner, just to make sure that I get the best. I know one day he'll hug me with a big hug, telling me congratulations. But I don't believe in this culture of saying that my grandchild is bewitched or whatever.
Yeah.
I'm a God-fearing woman, and I believe in God, the creator of heaven and earth. And I know God has a purpose with our autistic children, and that's why he created them with a purpose, for people to know there is a God. There is a God who creates each and everything that he desired, and it pleased him. Thank you so much.
Wow. Don't give up, like Dr. Sharma said. Dr. Sharma, I don't know about India. I'm African. If you don't mind addressing the culture surrounding persons with special needs in India before we wrap up.
So actually, it is very similar to what is there in Africa. And, these children are called all kinds of names, and, they're looked down upon. Other parents don't like their children to mix with these kids. And also, for some reason, there is always a tendency to put the blame on the mother. Like whenever there's a child with special needs, it's always the mother's fault. Okay, it never seems to be the father's fault. So there is that tendency. But fortunately, what's happened recently, our Prime Minister Sri Narendra Modi, he did something fantastic. He changed the nomenclature. So earlier there was a word for disability. It was called Divyang. That means Divyang meant disability, like people who can't do things. And he said, after this, we will not refer to them as Viklang. Sorry, it was Viklang. And he said, we will call them Divyang. We'll call them specially gifted. Divyang is godlike.
Look at that.
So now the official nomenclature from being disabled or Viklang, that means from being able to not do, that it is changed to having divine features. Divyang is having divine properties, Now, with the Prime Minister saying that and changing the official nomenclature, so now we can't use that old word. We have to use the word. And also the government came out, our Prime Minister came out with a beautiful act. It's called the Right of Persons with Disability Act. It's a new law. And that law gives a lot of special rights to parents. For example, very often normal schools do not take children with autism, but this law actually says that no school can refuse admission. So if a special needs child comes to you, you have to have a shadow teacher and you have to have inclusive education. And I think this is very important, because when the government starts giving rights to parents, when as parents you have a right, when you walk into a school and a school cannot say no to you because you're protected by the law of the land, that is when things start shifting. That is when change happens. So I think, if some of the governments in Africa actually just studied our rights of, it's called the Rights of Persons with Disabilities Act, and sort of incorporated some of those things, and there's nothing difficult. It's a law for people with disabilities, and there's nothing wrong with it. It's just giving you rights. It's giving you certain privileges. It's telling the rest of the world what can't be done. So this is when this happens, slowly, the attitudes change. And then and then of course there is this whole, new model, because now India is leading the world in stem cell therapy, the greater awareness, there is now hope. So the moment, a diagnosis is made, today parents, they will Google, they will find out. And moment they realize, yes, there is hope. So the big shift that has happened in India is unlike earlier, where once you had a diagnosis, all hope was taken away from you. The medical profession said nothing can be done. Society looked at you differently. Educational institutes didn't support you. The government, didn't give you protection. The insurance company said, well, if you have autism, we cannot, give treatments to you. Suddenly, a shift starts happening. It's a shift in the wind, So when you have government laws and when you have modern science, medicine, it gives you hope. It's whether you take the stem cells or you don't take stem cells, whether you do rehab, just knowing that it is possible to reverse autism, just know it energizes you. Okay,
It does.
It gives you,
yeah.
It gives you a direction. So it's like earlier you were, let's say you were shipwrecked and you're in the middle of an ocean with no direction. You don't know whether to go north, south, east, west because water everywhere and there's no help. Now, at least there's land in the distance. Okay. It's a long way, but you can slowly swim towards there.
Yeah.
Just having that direction, having that hope, seeing land. It's like if you're in a dark tunnel, there's light at the end of the tunnel. That itself is good enough because it keeps you going. Once parents have hope and they know something, parents of children with autism will do whatever it takes, to be able to help their children. But they need to know that there is something that can be done. The availability of stem cells, the availability of, integrative oxygen-based therapies and rehab, this together is giving you hope. So it is changing the way people are looking at the combination of research, modern medicine, new treatments, with government laws, with our Prime Minister saying you will not call them disabled anymore, you will call them specially gifted. It has changed the entire environment. I wish the rest of the world follows the same.
Yeah. Thank you so much, Dr. Sharma. I live in the United States where the laws to protect anybody who has any type of special need, there's so many of such laws, you cannot not mess with them. And I wish that just like India has done, other countries in Africa where I'm from would do that. And that can only come from the government. And the government cannot do that unless advocates like Sylvia and Winnie keep doing what they're doing. And someday it will effect change. Thank you so much for being on to Talk to Me Africa today. I know this is the beginning of many more conversations to be had regarding autism and any other special needs that we have here in the world. We just want to be there for them, and they are nothing less than the other children who are, in parentheses, normal. Thank you so much. I appreciate you being here today.
Thank you so much. Thank you, Sylvia. Thank you, Winnie. Thank you, Mabelle. It's been wonderful talking to you. Wonderful, very inspirational evening. Sylvia, especially you and Winnie, I want you to know that as parents, you're the ones who inspire us. You're the ones who motivate us, stimulate us. It's your energy. It's your cry for help that makes us, put in our sweat and blood and everything else to be able to do something. So I just want you to know that you're genuine inspirations, not just to other parents, but even to us in the field who are trying to do the best we can. Thank you so much, Mabelle. This was a wonderful conversation.
It was. Thank you.
Talk to me, Africa. Talk to me, Africa. Talk to me, Africa.